So the goal of this project is to shift understanding and practice of solidarity in global health. And as you know, during health crisis and other forms of crisis, people are often appeal to solidarity. However, the nature of the concept and what it means in practice can sometimes be debated, and it is very difficult to pin down. So part of our work is to acquire a better understanding of solidarity and see how we can transform this into actionable goals that can generate a sort of index that will hold actors accountable to in the practice of solidarity in global health. And we're doing this using a method of pluriversality, which is exploring from different parts of the world and different understandings, hopefully to be able to find some common traits that will help us to draw these actionable goals and the index for measuring solidarity. We have been holding workshops in different parts of the world. And next slide, please. And as you will see, our researchers are spread across the globe. We've had workshops in India, in Australia, in Costa Rica, in Ghana, in Guinea, and we will soon be holding another workshop in South Africa. And with these, we will come up with some actionable goals, and then with these actionable goals, we'll design the tools that will be used to measure solidarity. Having said this, today's webinar is divided into two parts. The first part is a theoretical part, where we will be looking at what is solidarity, what isn't solidarity. So we have three speakers who will guide us through that part. They will have short presentations, about 6-7 minutes each. At the end of the short presentations, we will open up the question and answer section so that people can ask questions to the speakers. And invite the speakers to introduce themselves when it is their turn to present. So the first speaker is Professor Barbara Prainsack from the University of Vienna, who will be talking to us about what solidarity is. Barbara, over to you.
Thank you very much, Cesar, and thank you everyone who has made this webinar possible and everyone who's here. So I couldn't see the slides earlier on, so I'll just share the slide deck, and I ask you for a moment of patience. It should be working now. If not, please let me know. So as our project leader Cesar was saying, what we're trying to do today in the first part of this webinar is to give a kind of conceptual input. As everyone here will know, the notion of solidarity is being used in very different ways. Sometimes it's mobilized as an empty phrase. Sometimes solidarity also is used in ways that many of us would consider problematic. So what we're trying to do in the first part of this webinar is to propose or share with you rather how we understand solidarity, how we propose to understand problematic forms of solidarity or also non-solidarity. And this is not meant to sort of prescribe how it should be used, but it's a proposal for everyone, and we are very grateful to hear from everyone what you think. So starting us off on what solidarity is, I mentioned that we haven't looked only at the Anglophone literature, but mostly at the Anglophone literature. In these literatures, solidarity is a very, some people call it a vague term. I wouldn't call it a vague term. I would say it's a term that is often used without being defined because authors assume that everyone knows what it means. And it's also mobilized in different ways to justify different goals, sometimes even to justify contradictory goals. For example, when on the one hand, solidarity is seen as an underpinning of universal healthcare. So it's used as an argument to argue that people deserve support when they need healthcare. And then other authors have also used solidarity as a reason to argue that those people who choose unhealthy lifestyles should be excluded So sometimes solidarity has been used to even justify contradictory goals. But if we look at the literature, I think three elements are almost always there in most definitions of solidarity. One, solidarity, solidarity is seen as something pro-social, something that helps others. The second is that it's not just a one-off thing. So if I'm supporting one person out of solidarity, that's sort of not enough. So it's a part of the social fabric of a society, of a community. And the third element is that we would put it in terms of a relational ontology underpinning solidarity. So this sounds, it's a mouthful. What does this mean? It means that solidarity is sort of based on the idea that human beings are not atomistic individuals who are all trying to maximize their own gain, but that human beings, and many people would argue also non-human living entities, are made by the relations that we have to others. So our relations to our human, non-human environments don't only influence us, but they make it to who we are. So these are the three elements that most definitions of solidarity have contain. So how can we make solidarity distinct from other pro-social practices? How can we ensure that solidarity has analytical precision so that, not everyone that anyone thinks is nice is called solidarity? And this draws on work that we did with a lot of other colleagues. It was also funded by the Nuffield Foundation. It goes back almost 20 years now that we started this work. So we defined solidarity as practices by which we support others with whom we recognize some kind of similarity in a relevant respect. So this similarity is not necessarily something that is objectively there, right? But it's something that people have learned to recognize as a similarity. So it could be a joint threat, such as climate change. It is often the recognition that others suffer from violence or from aggression, discrimination. And even if we ourselves haven't experienced the exact same kind of violence or discrimination, it is something that we can recognize in the other as something that we are afraid of as well, and we might have experienced in other forms as well. So this is what the similarity in a relevant respect means. It doesn't mean that we have to be the same according to objective criteria, but it's something that we can recognize in other people. So there are very wide, inclusive notions of solidarity that include all living beings or all humans. And there are also more exclusive forms of solidarity that are defined sometimes also along problematic lines, racialized lines, sexist lines, and so on. So Elias will say more about that. Also, of course, CISA has done a lot of work on solidarity in global health and beyond. CISA and his colleagues in many of his publications have defined solidarity as sympathetic and imaginative enactments of collaborative measures to enhance relatedness for well-being. So I think that's also a very, very helpful definition. But the key point is that we make solidarity, we separate it from other forms of support, so that not everything that is kind of charity and sympathy is lumped together under the notion of solidarity. That's the key point. And I personally think the key point that sets solidarity apart from other pro-social notion is that it's in the moment of enacting solidarity, it's an equal relationship. So you might be much richer than I am, or much smarter, or whatever. But when you enact solidarity with me or vice versa. We do this because we recognize each other as human beings or as people suffering from a particular danger or working towards a goal. So that connects us. And I'm coming to the end. This is my last slide. We believe that it's useful to distinguish three tiers of solidarity. So at tier one, it's really this person-to-person solidarity, people supporting each other because they have experienced an earthquake, they experience other people who they don't know who also have become victims of natural disasters. If this solidarity becomes normal in the sense of expected behavior, then it is group level solidarity, that's solidarity enacted within a group. And then at tier three, it's when solidarity is really institutionalized, when there are arrangements in a community or even laws and other norms that realize the spirit of solidarity. Then we talk about institutionalized solidarity. And with that, I'm handing over to Elias.
Thank you very much. I will now continue with what I call solidarity in crisis and theorizing parasitical forms of solidarity. In my research as a doctoral student at the University of Vienna, I'm concerned with the question what happens and how should we deal with the possibility of misappropriating solidaristic mechanisms. As we just heard, solidarity is usually something that we desire in a society to foster, as we mainly have positive connotations with that. And though I agree with that, I see the possibility to some extent that these mechanisms of solidarity that we just heard can be misappropriated to do something else instead of fostering social cohesion. So now we will look into that. Could I have the next slide, please? So yeah, solidarity, as I just said, is widely used and has also like a lot of different traditions. There's liberal social theory that that uses this concept to underpin their theory, but also Marxists and socialists politics use the term a lot, and even theological discourse in different religions uses the concept of solidarity to describe a lot of mechanisms in society. As we just heard, solidarity consists of people recognizing similarities with other people and deciding to help them by actually not only having sympathy with them, but by establishing an action, a concrete practice. And here, if we see this mechanism, there are two roles emerging. There's the role of people enacting the solidarity and of people receiving this form of solidarity. Political philosopher Sally Scholz, for example, called these two roles the solidary group who enacts these practices and the oppressed group who is on the receiving side of solidarity, as she mainly thought of solidarity as something that happens when there's a struggle against oppression or injustice. But as we just saw, this is one part of solidarity. Solidarity is an everyday action that goes beyond this. These categorization of enact and receiver seem very rigid, but in fact, they are part of sort of daily. Sorry, I'm losing the word in English. Yes, Cesar, you want to jump in of a Aushandeln of a process of
negotiation.
Of negotiation. Thank you. And in this process of negotiation, the practice is the central element that is established to enact this form of solidarity, because the nature of this practice decides on who we see as the receiver and who is supposed to enact, and what consists of this enactment. Yes, next slide, please. So as already mentioned by Barbara, there can be two problems that arise by this process of negotiation. First is the exclusion. There are a lot of forms of solidarity that can be very exclusive only to a certain group of people. We see this a lot in the context of nation states that limit access to healthcare to only their citizens. We have seen, as I'm illustrating here, even more oppressive forms of this solidarity. We have to acknowledge that there are some forms of exclusion that are unproblematic because they do not concern actual basic needs. But in the moment where solidarity excludes from the fulfillment of basic needs, and might it just be social participation, this becomes very problematic. But I'm now not focusing on this. I'm focusing on what I call misappropriated solidarity. Can I have the next slide, please? So what do I call misappropriated solidarity? Or even with a more harsh word, parasitical solidarity, call a phenomenon where these mechanisms we just saw are used to engage people in enacting a certain practice, but on a closer look at this practice, it is not, it cannot fulfill the promised help to the people it is supposed to help. Can I have the next slide, please? So to illustrate that, I just showed you a picture of a wheelchair-friendly bench. And here we have a case of misappropriated solidarity, because the people that are trying to establish this bench as a solidaristic practice with wheelchair-bound people, they try to mobilize this mechanism of solidarity that we see, this vulnerability of people in a wheelchair and their need for social inclusion. Then this bench is proposed as a form of providing this inclusion, but it lacks, it cannot actually achieve their goal, because to include wheelchair-bound people, we should listen to what they need. And if you ask wheelchair-bound people, they will tell you, as was the case with this picture I just showed you, that this is not their highest priority. I mean, it's a nice thought, but as a wheelchair-bound person, there can also, with this example of a bench, just sit in front of the people sitting on the bench. And what is happening here actually is a municipality that wants to tackle a wholly different problem, at least a problem in their mind, homelessness, are trying to create an environment that is not attractive for homeless people. So as people would not be very happy if, as a municipality, you openly state this goal, they try to hide this goal behind a solidaristic motivation to include wheelchair-bound people, without actually tackling the problems of wheelchair-bound people, which lie usually in accessibility to these spaces with ramps and other infrastructure. And therefore, I would categorize this as a form of misappropriation of solidarity. Yeah, in my opinion, there are a lot of examples that you can find in the wild where this happens. the question we have now to ask is, why does this happen? And I would wish I would have an answer to that, but I don't. So I hope we will move closer to such an answer with this workshop. Thank you very much.
So thank you, Elias. Dear colleagues, our next speaker, our colleague Natalia Varabyeu Kancelova.
My name is Natalia Varabyeu Kancelova. I'm a predoctoral researcher at the Department of Political Science of the University of Vienna in Austria. As such, I'm a member of the Center for the Study of Contemporary Solidarity, which is led by Professor Barbara Prainsack. In this presentation, I will introduce you to the concept of unsolidarity, which in existing literature is highly under-theorized, and which I'm therefore currently developing as part of my PhD project. In my view, unsolidarity shouldn't be seen as simply opposed to solidarity, so marking a lack of solidarity, but it constitutes a highly relational and as such also a destructive practice in its own right. What I am interested in is what happens when there is nothing in this relational space between an in-group and an out-group, although it should be. Understanding this is especially important in relations to vulnerable outgroups, such as refugees, which naturally have and also articulate their needs as an incoming group towards the host societies. If this relational space is intact, then the host society is able to address these needs by showing and taking responsibilities. As such, using power, which is on the side of the in-group, in order to help the out-group in need. What happens when unsolidarity occurs is that this relational space starts fading away or is entirely missing from the beginning on, often because the in-group uses all powers it has in order to protect its resources from the out-group. This, more often than not, tends to happen in times of crisis. So what we can see is that unsolidarity is not simply an absence, but a relational space between these groups, and that is shaping also democratic cohesion as well as institutional responses. So the main question I'm trying to tackle with the theoretical paper of my thesis is, how can the currently undefined concept of unsolidarity be theoretically developed and refined as an analytical lens for future empirical research? The main definition of solidarity I built my concept of unsolidarity upon is this one. According to Prainsack and Bux, solidarity is an enacted commitment to carry costs, financial, social, emotional, or otherwise, to assist others with whom a person or persons recognize similarity in a relevant respect. When talking about what exactly is missing when this sort of unsolidarity occurs, we can derive from this definition two main dimensions it can consist of. The first dimension is socio-economical. It means you bear costs for other people, and if you act in unsolidaristic manner, you simply refuse to do so. The second dimension is cultural. That means that you recognize similarities with others, and when you act in unsolidarity, you cannot see any similarities. Quite the contrary, you perceive and treat them as the others. So now let's take a look at how these two dimensions interact and how they can create a downward spiral of unsolidarity if the circumstances allow for this. This escalating continuum is meant to show that solidarity, if it ever was there, doesn't simply vanish, but there can be different stages where it sort of mutates downwards. Also, these forms on the continuum mark very different levels of potential harmfulness towards the outgroup. So let's take a look. On the constructive side of the continuum, we can find the solidarity as it normatively should be. So both the socio-economical as well as the cultural dimensions are intact and are used to, for example, provide shelter or other types of support to displaced persons. Going one stage further, it can happen that one of the dimensions sort of erodes due to different reasons. For example, the socio-economical dimension of bearing costs starts seeming too unbearable, but you can still sort of identify culturally with the cause, so you are non-solidaristic because you in principle agree with something, but you don't want to contribute actively, you don't want to bear any costs, like in this example of climate action. Going even one step further, we can find unsolidarity when both dimensions of solidarity are absent. You don't bear costs and you don't recognize any similarities. An example could be when a government simply turns away asylum seekers at national borders. This is an active denial of solidarity and a really harmful one. And there can be even one more step that can be reached. And this is when you become openly hostile towards the outgroup. So when any sort of intentional violence is involved, and when both solidarity dimensions are intact, but in an inverted form in order to harm those whom you perceive as others and whom you actively dehumanize. The most extreme example of this would be war, which then creates even more needs, even more displaced people, even more suffering. So as you can see, these forms do not simply exist next to each other, but they tend to sort of reproduce themselves, which then creates this sort of a downward spiral. So what is the added value of defining a destructive practice like unsolidarity? First of all, I would like to stress that unsolidarity isn't meant to be or to become an advocacy tool, simply to label your political opponents of unsolidarity. It should be treated as an analytical lens that allows us to identify blind spots of solidarity. So places where solidarity erodes or was never activated in the first place, although it should have been. And solidarity can also help us understand that solidarity itself is extremely important, but tends to be fragile. And finally, only by understanding unsolidarity, we can make the real importance of solidarity visible, and as societies and individuals identify where changes for the better are both possible and necessary. Thank you very much.
Thank you very much, Barbara and Elias. And thanks to Natalia. This has been very interesting. We'll soon open up to questions and answers. What we've heard now is the initial presentation, which is trying to pin down what solidarity is, which basically is, enactments that carry some form of personal cost based on our similarity with others in a relevant aspect, and then how this solidarity can be institutionalized into three tiers. That is, that was the first part. The second part was more about misappropriation of solidarity, when solidarity becomes a vehicle to achieve other ends, and yet we keep calling it solidarity, and therefore it is actually not really even in the interest of the people we're supposed to be standing in solidarity with. And now the final part of unsolidarity, which is basically turning a blind eye to the needs of others or just paying lip service. And so with these three presentations, which have helped us to, dig deeper into the concept of solidarity, I would like to, open up to questions. I see there are some questions already in the chat, and maybe I can start by reading one or two of those questions, and those who have questions, maybe by the show of hands, we will be able to, allow you to ask your question. So there's a question here from Arnaud Soa. What is the difference between unsolidarity and non-solidarity? I think that is for Barbara. Yes.
Thank you very much, Arno. So here, Natalia and I would give slightly different answers. I'll give you both because I've discussed this with her. Natalia would say non-solidarity is when either the recognition of some similarity is missing, or the willingness to accept some costs is missing. One of the two. And unsolidarity is when both is missing. That's Natalia's answer. My answer is slightly different. So maybe as time progresses and as our research progresses, we will sort of coincide. But my answer would be to say non-solidarity is when solidarity is absent, but it's not needed. This was the example of my neighbors, right? They're not being solidaristic with me right now, but I don't need it. If, God forbid, there was a fire in my house and they wouldn't support me, although they could, that would be unsolidarity. So unsolidarity is when solidarity is missing, despite the fact that there's an expressed need. And non-solidarity is the absence of solidarity when it's not problematic. That would be my answer. I think nobody can claim that their answer is the right one. We're very grateful to hear from colleagues what they think.
Thank you very much. I see there are some hands up. So we have, is it Rugare Chingrande? Could you just introduce yourself and ask your question, please?
I'm trying to unmute.
Yes, we can hear
Morning.
you.
Right. So
Yeah,
I'm in the other part of the world. Right.
Where are you?
In Cape Town.
Oh, wow. Okay.
On the southernmost part of the world.
Very good to hear you.
I have a comment.
Yeah.
Something that I keep missing in this discourse, which are two issues. One is intentionality, and the other one is fallibility of acts. I think solidarity it is often intentional. Right? So we carry the act of enacting the needs of another intentionally. Right? So if we look at Elias' work on parasitic solidarity, I would say in biology, there are two types of parasites. The first one, I would call it symbiotic parasitism. For example, in your stomach right now, you have bacteria that are parasites. They benefit from the environment in your stomach, but you also benefit from it because it helps a lot with your health, right? So this is a relationship that we see a lot in long-established solidarity relationships, right? But there comes a tipping point where one gets to benefit much more than the other. And that becomes very problematic in the sense that you still carrying out the acts of helping somebody, but you end up benefiting much more from that than they do, which sometimes we see in global health actions couched and framed as solidarity. So that's intentionality. And then the other aspect is what I would call fallibility, where people choose in good faith and goodwill to enact solidarity acts towards other people. But for one reason or another, they do it in a flawed way. And that becomes problematic because the recipient receives it in a different way. Right. So when I take these two together, they are both objectionable. Therefore, I think there is another form of solidarity which I would call objectionable solidarity. And we see a lot of this in recent times, but even before that it was there, where people deliberately say, no, thanks. You have come to me in good faith of solidarity, but in good faith, I can't receive your solidarity acts. So it is objectionable because the receiver objects. Thank you.
Thank you very much for that question. Barbara and Elias, do you want to come back on that?
I did not really see a question here. I just can say that I agree with that statement. these are the two types that you can find in this convoluted concept of misappropriated solidarity. I don't know, Barbara, you want to add something?
I think thank you very much. First of all, nice to see you again, and thank you very much. As Elias was alluding to, I think the notions of intentionality and fallibility make explicit something that was quite implicit in our thinking, and especially the fallibility, I think, needs to be teased out more. So I'm very grateful for you to say that. With the intentionality, I will say one thing. I agree with you on intentionality. I guess the reason that we haven't highlighted that is very much that in much of the sort of Western, especially North American scholarship, intentionality and rationality is emphasized. And I think it's very important that we maintain that solidarity sometimes happens without people reasoning about it. So solidarity is an action term. That's one of the differences to justice, right? Solidarity sometimes happens before and without people are able to articulate why they are solidaristic. This includes intentionality. I don't disagree with you, but just to explain why maybe we haven't emphasized that, because we don't want this kind of slippage to rationality, that solidarity needs to be rational, right? It doesn't need to be. But thank you very much for this helpful comment.
Excellent. Thank you. Thank you both very much. I think what we're going to do now, since the clock is ticking, I'll take two questions that I see two hands raised up, and then we'll have a brief answer before we move to the next section then. So we have Ardita Pramudani, forgive me if I'm pronouncing that in the wrong way, and then we have Doji Koku Hato. Ardita, could you come in, please?
Yes. Oh, yeah. Thank you so much, professors, doctors. Let me introduce myself. My name is Ardita. I'm a medical doctor, and then I train in bioethics. Now I'm a lecturer in Indonesia. So when I heard about this webinar, I was really interested because it's themed global health delivery, and I'm from a country that still needs more global health delivery. But I'll make this question quick. So to all the speakers, I found the continuum of unsolidarity is fascinating, especially how it's escalating harm. So I'm asking, in your experience, how do or what helps push institutions, maybe even communities, back toward the solidarity end of that continuum? So rather than letting disengagement grow, because coming from a big country, sometimes there's competing interests. And so how do we actually, in your experience, manage that? Thank you.
Excellent. Thank you very much. Doji Hato, could you?
Yes. Stemming from her question, I'm also thinking of how historical facts could also affect on solidarity. So when you're answering a question, how historical facts can also affect that. Thank you.
Great. So, Barbara and Elias.
Elias, do you want to go first?
No, please go first. I think the questions were directed at you also.
Yeah, so thank you very much to both of you for your questions. These are huge questions, and I can't do it justice. I will say that Natalia is looking at this also empirically, but specifically for the domain of refugees in Europe. And in terms of how to do that at the institutional level, what kind of measures, what kind of discourses, what kind of political discourses can foster solidarity rather than harm it. I will take this opportunity to refer to my forthcoming book, where I have a chapter where I identify the criteria. But this is very much aspirational. My honest answer is that at the moment, in most countries of the world, I think we see the escalation towards what Natalia calls anti-solidarity, rather than what I call states of solidarity. So one thing that I will highlight, and then I'll shut up. One thing is that the political discourse, the public discourse, is very important in a situation where we constantly emphasize how people are different because they are too fat, or they look different, or because they don't pay enough, or they don't work enough. As political discourse that emphasizes difference makes it much, much harder for solidarity to emerge and institutionalize, because it's much harder to see the similarities. That's what I will say, and I'll put the link to the book also in the chat. Thank you.
Excellent. That is very helpful. There was another question in the chat that I wanted to read out, and then actually, I mean, I'm having problems accessing the chat. Did the person who put the question, you can actually raise your hand.
Yeah, there's a question, how can solidarity exist without similarities? I can't read the name.
Yes.
Yeah.
Yeah, so I can answer that. It can't. But the key point is that those similarities don't need to be sort of things that correspond with objective demographic criteria, right? We don't mean to say you can only be solid if you're a woman. You can only be solidaristic with women, and if you belong to a certain faith, you can only be solidaristic to those. That's not what we're saying. We say that what we recognize as a similarity very much depends on what we want and have learned to see. I can see a million differences between Caesar and myself, but I can also see a million similarities. I would say Caesar and I, despite Caesar being a man and I'm being a woman, and so on, we are still much more similar than we are different. And do I create policies and institutions on the basis of the similarities or on the basis of the differences? That's a decision. And of course, this doesn't mean that we shouldn't talk about differences in power and agency and resources, but solidarity happens when we build societies and institutions despite the differences and fragmentations that the ruling elites often impose on us.
Excellent. This is great. So we have now come to the end of the first part, which was the presentation of these conceptualizations of solidarity and the problematic practices and within solidarity as well.